Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, worries over interstate spread of coronavirus heightens. Experts give advice. Lagos, Kano and the Federal Capital Territory top 3 COVID-19 cases in Nigeria. And England eases lockdown as United Kingdom economy shrinks. Even though Nigeria believes it is making progress in the fight against the coronavirus, the Presidential Task Force on COVID-19 is worried about the rising data of the disease as a result of interstate travels. Yesterday, the National Coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu, alluded to claims that more Nigerians have been infected through this process. As the federal government warns against state travels, we look at the implications in the strive to curb the coronavirus on our theme today. In the meantime, a total of 4,787 confirmed cases of COVID-19 has been recorded in Nigeria, according to latest figures from the Nigeria Center for Disease Control, NCDC. It also puts the number of patients discharged at 959 and those that have died at 158. The new cases were recorded in 19 states, the FCT and Lagos having the highest cases, followed by Kano. The regional figures shows the city leading in the southwest and the country with 1,990 cases, followed by Kano in the northwest. Of course, the FCT is the highest in the north-central. Bauchi displaced Borno State in the northeast, with cases in the state rising to 190. Edo State still leads in the south-south with 88 cases, and Enugu in the southeast with 11 confirmed cases. The National Agency for Food and Drug Administration and Control, NAFDAC, says it has received application from one company for approval to the agency for the treatment of the symptoms of COVID-19 and not for the cure. According to the agency, a claim of a cure must be subjected to clinical evaluation through well-controlled randomized clinical trials following an approved clinical trial protocol. The Director General of NAFDAC also said the drugs of today's modern society are products of research and development by major pharmaceutical companies, but it should also be mentioned that many plants are similarly very poisonous, and NAFDAC will continue to make sure that only medicinal products, including herbal remedies, that have proven safety data will be approved for use by the public. The agency explains the labels must bear a disclaimer informing the consumer the claims have not been evaluated by NAFDAC, the minimum requirements of proof of safety, as the agency's way of encouraging production of herbal remedies from the country's rich diversity of plants. And now more about finding solutions to the COVID-19. Joining us on the program is Professor of Phytomedicine, Department of Plant Biology and Biotechnology at the University of Benin, Professor MacDonald Idu. He joins us via Skype. Welcome to the program. First, tell us about your field, phytomedicine.
Thank you very much. I'm happy to join you today. Well, phytomedicine is a combination of two words, phyto and then medicine. And then phyto means plant, and then medicine, which we all know. To make it easier, let's look at perhaps the definition of work in 2005 and early in 2008. They defined phytomedicine as the plant-based traditional medicinal or medicine practice that uses various plant materials in preventive and therapeutic processes. So that gives you a very broad idea about phytomedicine. It's just all about the medicine from plants.
Phytomedicine help treat COVID-19?
Yeah, it's highly relevant because it's nature-based. And I've always said this, that for a country as big as Nigeria, we need to have indigenous solutions for indigenous problems. We can't keep relying on foreign aid and foreign input, especially when it comes to things as wide as this. We need a Nigerian solution to this problem. And the plant and our bioresources are so huge. And so much research has been done, so much work has been carried out. And we don't really have any reason not to, tap into it, especially as it regards to COVID-19. A lot of persons have come up and they've suggested, a lot of persons have come up with so many kinds of products and all of that. We can't just wave them up with a wave of the hand. We need to look at them as scientists, and then we need to prove the ones that are efficacious, and then we need to project those ones, just like what Madagascar did.
In Madagascar, the federal government has decided on a clinical analysis of their COVID organics as a herbal solution to COVID-19. What's your take on that?
I think it's very simple. I think it's rather unfortunate, very unfortunate. It's a big minus for us as a country because we say we are the giant of Africa, and I can tell you the truth. Nigeria is blessed. We are so blessed that we have no reason to concede this championship to a small country as small as Madagascar. We have all the persons here, all the herbal practitioners, we have the scientists, we have everybody, the medical doctors, everybody. We are all on ground, and we are just there to make this thing work. We have talked about it, and now they've taken the shine off us as a country. I just hope, I just wish it never happened. But we're already there.
In terms of what we have available in our resource, are you saying that Nigeria has the propensity, or perhaps can indeed find a solution, and that is a herbal solution to COVID-19 with our own resource in terms of phyto?
Of course. Of course, the hands are right. We are here, and we know that the solution to it is here in this nation, is here in this country. COVID itself is a simple process, and once we're able to take care of that simple process, especially your immune system, once you're able to set up your immune system, I don't think you will have much problems, getting so scared about COVID-19. And I think another mistake that we are making here is to create fear in the hearts of so many people. And fear is an emotion that decreases your immune system. I think we are exposing this country to so much harm by the way we are projecting, the fear of COVID-19. As a country, I believe that we should be very careful, and we should not get to that point where we start getting sorry for ourselves if this thing escalates, more than what we have right now.
Professor Edu, the World Health Organization had warned against the use of some of these organics without any medical supervision, cautioning against self-medication. Would you say that the body is open to an African solution to COVID-19?
It's very unfortunate that the World Health Organization will, quickly come out with that kind of statement. I felt very, very bad when I heard it. A lot of persons, have the opinion that it's because it's Africa, and I tend to, swear myself to that. They believe that nothing good comes from Africa, and that's not true. I've had so much bad experiences, concerning this, especially in the area of research, and publication. They just feel that nothing good comes out or can come out from, Nigeria or Africa. But that's not true. Like someone said, if it has been a developed country like Germany or or America that came up with the COVID product that Madagascar got, perhaps the whole world will have been celebrating. I think there's a political dimension to it, and it ought not to be so.
We appreciate your time, Professor MacDonald Idu of Phytomedicine, Department of Plants, Biology, Biotechnology, University of Benin. Thank you for joining us on the program.
Thank you, Millie. Thank you. I appreciate it.
Now, 34 states in Nigeria now have confirmed cases of COVID-19. Only Cross River and Kogi State appear not to have a confirmed case of the virus. But 3 among the 34 states seem to have much more cases. They are Lagos, Kano, and the Federal Capital Territory. Records from the NCDC shows Lagos State, which recorded the first index case in Nigeria, has since seen a surge of cases almost on a daily basis and is the epicenter of the virus with 1,990 cases, while Kano, which recorded its first index case in April after the patient was diagnosed at the reactivated COVID-19 laboratory test center at the Aminu Kano Teaching Hospital, where he tested positive. And since then, it's almost been a rapid increase afterwards, and Kano is in second place after Lagos with 693 cases, while the FCT in third place has 360 confirmed cases. The Presidential Task Force and the NCDC advises the use of physical distancing protocols and also hand washing, while calling on full compliance to ban on interstate travels. Yobe State has recorded additional 7 cases of COVID-19 after almost 2 weeks of silence, of no case, that is. Addressing journalists, the Commissioner of Health and Vice Chairman, COVID-19 Committee on Prevention and Control, says the state now has 16 active cases, 4 deaths, and yet to discharge a patient. He also explains the 2 new deaths recorded were as a result of late reporting to health facilities, as they were already manifesting severe symptoms, as at the time they reported to hospital. Mr. Ghana adds the patients died of the disease before the results of their samples were collected came out, and that they did not have contact with previous cases.
We have 20 confirmed cases of COVID-19. Then, of course, 4 people died. 3 here in Damaturu and then 1 in Guru. But however, all the people died as suspected cases. It was posthumously that we now, because samples were collected before and then sent. By the time the results came out, of course, they had already died. And I would also want to point out the fact that all the people that died actually presented very late to the health facility, and then of course they were put on isolation. And of course, almost all of them had underlying chronic illnesses.
We're bringing you this story just in, where the former Minister of External Affairs, Professor Ibrahim Gambari, has been appointed as the Chief of Staff to President Muhammadu Buhari. The Secretary to the Government of the Federation, Mr. Boss Mustafa, formally announced this before the commencement of a virtual Federal Executive Council meeting at the Presidential Villa. Professor Gambari replaces former Chief of Staff to the President, Malam Abba Kyari, who died from COVID-19 on April 17, 2020, the first high public profile official in the country to die from the disease. Professor Gambari hails from Kwara State. Let's go on a break now. Still to come, more efforts across states on flattening the curve. That's in a moment. Welcome back. And across states, we have 5 more COVID-19 patients that have been discharged in Uyo after testing negative twice. The State Commissioner for Health, Dr. Dominic Upong, disclosed this while addressing journalists at the Bomb Specialist Hospital shortly after they were discharged. According to the Health Commissioner, those discharged include a medical worker with the University of Uyo Teaching Hospital and a nursing mother who had to be given special treatment at home since she had a 7-month-old baby and 2 infants in her care, but all the children are negative. Over in Kaduna State, also 12 additional COVID-19 patients were discharged, including 11 Almajiri from the state's isolation and treatment center. This was confirmed by the State Commissioner for Health, Dr. Amina Baloni, who is also the chairman of the Kaduna State COVID-19 Emergency Operations Center. She says Kaduna State now has discharged a total of 27 patients, while 80 active cases are still undergoing treatment at the isolation center. And chairman of the Kano State Council of Traditional Rulers, Sarkin Kano, Alhaji Aminu Ado Bayero, has called on Kano residents to take the compulsory use of face masks seriously because it's one of the most important ways to stopping community transmission of COVID-19. The traditional ruler says that all the 5 emirates in Kano State are fully committed to sensitizing their people. And medical practitioners in Katsina State have expressed concern over the rate at which positive cases of coronavirus frequently affects practitioners operating in the state. According to the chairman of the state's chapter of the Nigerian Medical Association, Dr. Nafiu Abdulaziz, the ratio of doctor to patient has not been up to the WHO standard. He, however, attributes the rising cases of the virus in the state to massive community spread, adding that measures that ought to have been taken have been delayed. And in Nasarawa State, north-central Nigeria, over 30,000 indigents have received 20,000 naira conditional cash transfer approved by President Muhammadu Buhari to ease the COVID-19 hardship. The disbursement is taking place at different locations and targeting 48,630 indigents across 5 local government areas of the state. Now, boosting the morale of frontline health workers will go a long way in ensuring that there are enough medical personnel to sustain the fight against COVID-19. This is the opinion of a public health physician, Dr. Oguchukwueze, who also believes that government needs to do more in the area of community engagement to get Nigerians to understand and appreciate the gravity of the coronavirus.
For people who are involved in case management at the treatment center, I think the government is doing their bit to ensure that these people, they have everything that they need for that treatment. Of course, where we're having little challenge are the people who are in the field, because like I tell people, it's an expensive response. You need quite a number of people for contact tracing, for active case search. And a lot of times these people need to be sufficiently motivated in terms of financial benefits. I think it's a challenge we're having across the different states in Nigeria. We're not having the sufficient number because we don't have the sufficient budget to actually support these health workers. I think one of the greatest challenges we're having currently is the trust. People's trust in government. And that affects the way they see the messages which are being sent. As of today, a lot of people don't believe that COVID-19 is in Nigeria. I always tell you, look at what is happening in Europe, in America. You say that COVID-19 is here, why are we not seeing that level of death? Which means even the messages are being passed across through the radio, through the conventional media and social media. People are not taking it seriously. So I think what is needed now is a lot of community engagement by the government, engaging the community leaders, the community structures, seeing how these messages can be passed down through these structures.
So a lot more sensitization needed. Well, the UK's economy has shrunk at the fastest pace since 2008 as lockdown restrictions ease up after more than 7 weeks. People who can't work from home are being encouraged to return to their workplaces. Russia is suspending the use of ventilators suspected to have been the cause of a deadly fire at a St. Petersburg hospital, which killed at least 4 COVID-19 patients yesterday. And over 4.2 million cases of coronavirus has been confirmed in the world, according to the Johns Hopkins University statistics. Of that figure, over 291,000 have died, but close to 1.5 million people have recovered. Here's more on our global update. 4.2 million cases of coronavirus has been confirmed in the world, according to the Johns Hopkins University statistics. Of that figure, over 291,000 have died, but close to 1.5 million people have recovered. Here's more on our global update. 4.2 million cases of coronavirus has been confirmed in the world, according to the Johns Hopkins University statistics. Of that figure, over 291,000 have died, but close to 1.5 million people have recovered. Here's more on our global update.
England tentatively begins easing its coronavirus lockdown on Wednesday, with some people who cannot do their jobs at home urged to return to work as stark economic data show the disastrous impact of the pandemic. Britain has been in extensive lockdown since March 23rd due to COVID-19 and is now the worst hit country in Europe. GDP data released on Wednesday showed the economy shrank by a record 5.8% in March compared with February, and the April data is likely to be even worse as the country was under lockdown for the entire month. Normal life seems to resume in Paris a day after the lifting of strict confinement measures by the French government. France tiptoed out of its strict coronavirus lockdown on Monday, allowing non-essential shops, factories and other businesses to reopen for the first time in 8 weeks to help resuscitate the economy despite the risk of a second wave of infections. France has the world's fourth highest official death toll, standing at 26,991. The United Nations is distributing food packages for migrants in Libya's Tripoli during Ramadan to help them in the crisis of the coronavirus outbreak. The migrants mostly work as day laborers and rely on odd jobs to make a living, but since the measures imposed to curb the spread of the coronavirus, many cannot find work. Since it is now compulsory to wear face masks in public, gaming hardware maker Razer plans to help residents in Singapore with that. Razer plans to dispense its locally produced masks through a network of vending machines across the city-state. The company said it will initially deploy 20 machines at some Frasers Properties malls and Just co-working centers around the business district by June the 1st, when Singapore is set to lift the lockdown measures.
Take responsibility in protecting your health. That's the message from the Nigeria Center for Disease Control. It also says that viruses that causes COVID-19 can spread by touching a contaminated surface and then touching the face. So while in public, please avoid touching door handles, stair rails, and others as much as possible. Regularly clean all surfaces with soap and water or disinfectants. The website has all the information and statistics on the cases across states with regular updates on the COVID-19 regulations and several guidelines as well. And, with regards to what it means by social or physical distancing, you can also find frequently asked questions where you have more information as to COVID-19 in the country. Also from the World Health Organization, WHO, physical distancing is one of the most effective methods to limit the spread, and it's advocating you can stay home when possible, maintain at least a meter distance between yourself and others. The website has rolling updates on the pandemic, strategies, plans on the coronavirus each moment. It keeps updating on the number of cases, the number of deaths, and the recovery efforts across board. You can take a closer look at some of the numbers in real time. Well, that's our COVID-19 update on Channels Television. Thank you for watching. Another update comes up at 6 p.m. In the meantime, you can catch up with more news on our website, channelstv.com. I'm Millicent Nwaka. Bye for now.